The Knox County Health Department continues to share updates several days a week, and we are using that opportunity to take your questions to the experts. Today, we started with something you've asked us a lot about. That's testing.
What I can say about testing here in Knox County is right now our medical providers are working on increasing their capacity to test the patients that come see them. And our emergency rooms are also increasing their capacity to test people that come to see them. I want to emphasize that only people who are sick need to be tested. And if you're not sick enough to go to the emergency room, call your doctor, and always call first before you go get tested. Always call first before you go get tested. They might be able to save you a trip because you might not need to be tested after they talk to you. We are also doing some testing. It's very limited to folks who fit in a high-risk category based on the Tennessee Department of Health guidelines. We also want you to call us before you come get tested. I think the governor is referencing some quick drive-through type testing facilities. We are working with some partners to look at how we might be able to do that here in Knox County. As you can imagine, there are a lot of logistics to making something like that happen, and a lot of partners having adequate supplies, being able to screen people who need to be tested versus people who just want to be tested. Again, if you're not symptomatic, you don't need to be tested for coronavirus or the flu or anything else. Only symptomatic people need to be tested, and symptoms, fever, cough, and sometimes shortness of breath, but fever and cough generally are going to get you tested for the flu maybe, or for COVID-19, depending on the rest of your story.
You mentioned fever there. What kind of degree temperature should people be looking for to say, okay, I might need to?
The general rule of thumb that we use when we're talking about fever is above 100.4. So 105 and up. For adults, it's different for children. And I honestly don't have that off the top of my head. It's a little bit lower for children than it is for adults.
How many tests have been performed in Knox County so far?
You know, private providers are testing, hospitals are testing, we are testing. We're not able to keep track of all of those tests because not all of them are coming through our health department. We're not going to be giving out that information. We are not able to keep track of all the tests being done by private providers and others in the community, but that don't even come through the health department. Yeah, everybody's testing every day. We're working with providers to increase access in their offices. We're working with patients who are having trouble getting access, screening them, and offering them testing if it's appropriate through our system. Or we're also working on finding places that are testing, so that if you call us and we know where they're testing, we can send you there to get tested if that's appropriate.
So help us understand if it's a private, if it's a hospital versus you guys versus someone else. If they test and test positive, that information all goes to the state and is released in the way we've seen it, so we don't have to worry about that.
Absolutely. We have a really great reporting system. It's an automatic reporting system through the labs. Now that COVID-19 is a reportable disease, like there are several other reportable diseases in the community and across the country, those test results go to the Tennessee Department of Health first, and then they come to us and to the provider as well. We'll be reaching out to those people who do test positive, educating them about what they need to do, how do they protect their loved ones and the people around them, and asking them a lot of very specific questions about their activities 7 days before they got sick, just like we do with lots of other infectious diseases that we investigate every year.
It's been said that a lot of patients might be asymptomatic. How can we know if those people need to be tested?
Well, I think if you look at the studies that came out of China, they didn't really find a lot of asymptomatic patients. They found people with mild symptoms. They didn't really find a lot of asymptomatic patients. And what we know about the science of disease and spread of illness is that you're most contagious. You shed the most virus when you're sick and have a fever. So if you don't have symptoms, you're not shedding very much virus because your personal viral load is not very high. And again, the studies in China really didn't reveal a lot of asymptomatic people.
If we don't have the number of tests that we're doing in the county, how are we supposed to evaluate the number of positive cases that we're seeing if we don't know the baseline number of tests?
Well, so knowing the number of people tested doesn't give us any idea of the level of disease in our community. The positive number helps us see what the level of disease is in our community, and right now that positive number is one isolated case.